Obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient's safety comes first.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar, Castries, Groselet, Beaufort, and Surage.
It's delicious.
Join Dr. Leonard Surage on Rev-Up St. Lucia 97.1 FM Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1-hour discussion call-in program delves into the science of various diseases, treatments and medical processes, and offers in-depth explanations to empower listeners and help ensure a better understanding of healthcare for all. So tune in on Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House with Dr. Leonard Surage, only on Rev-Up St. Lucia 97.1 FM. Time now for Doctor in the House, hosted by Dr. Leonard Surage. Dr. Surage, a very good evening to you.
Good evening, Andre, and good evening, listeners, good evening, viewers on radio, Facebook, YouTube, and X. So we're streaming live on these channels, and today I have a special, as usual. I usually have something quite special. Today I have a special, but it is a different specialty that I have not brought in to the station before. However, we will proceed, and I'm happy to be back. I was out for a short while doing an ENT conference, attending an ENT conference in Trinidad, so I'm back in full swing. And today I have with me Dr. in internal medicine, and I want to tell you all a little more about internal medicine. She is Dr. Alpha Augustine, who did her undergraduate degree in Cuba and subsequently did her advanced internal medicine training at the University of the West Indies in Barbados. She graduated not too long ago and has joined us on the staff at Tapio Hospital. She is actually part of the walk-in clinic. You may have heard about a walk-in clinic that we have so that doctors can come in and offer their services at reasonably good rates. So we something new that Tapio is trying, just to make the service more accessible to the average person. So before I run and talk too much, I would just like to introduce Dr. Alpha Augustine to you. Dr. Augustine, welcome to the program. I know this is the first time you're doing this program with me. Hope not the last. And I'm happy to have you here and so forth. So just, is there any special thing you want to say to the general public before we start? I know you have a special interest in pulmonology, which is the lungs, studying the lungs, and also in endocrinology, which is about the endocrine system. I don't want to steal your steam, so I'll ask you to just say a few words.
All right. Thank you, Dr. Surage. Good night, Andre.
Good evening.
Thank you for having me tonight. Yes, I studied internal medicine, which is a specialty that is one of the I guess older ones and one of the more general specialties. So like general surgery, pediatrics, gynecology, internal medicine is one of the big specialties.
Yeah. In fact, when you go to medical school, the four main areas that you learn is internal medicine, surgery, obstetrics, gynecology, pediatrics. Right. Those are big ones.
Right.
So internal medicine has been along for a long time. And I'm sure they are, like other specialties, they have branches of internal medicine which are specialist areas in themselves.
Yeah, so internal medicine is very broad. It covers many other subspecialties, of which cardiology is one, which studies the cardiovascular system. You have pulmonology, which I do enjoy practicing, which studies the lungs. You have the endocrine system, like you said, which studies different hormones and the endocrine system of the body. You have neurology, which studies the brain and the nervous system. The gastroenterology, which studies, digestion. So from the mouth to the anus, it looks at all the processes in between. You also have rheumatology, which studies the joints, and there are many other subspecialties that you could study further after completing internal medicine training.
Yeah, and these specialties can be very, very detailed.
They are.
And I know, for example, if you want to study in some universities, you can probably start by just by going directly, say, to cardiology.
Yes.
But in some countries, so in some universities, you'd have to do internal medicine first to give you the grounding.
Yeah, that is correct. Even in those where you could go directly into cardiology, I think at least the first year, the first 18 months definitely includes some part of internal medicine. As a lot of the patients who have cardiac problems do have other general conditions that you would have to know prior to branching into cardiology.
So what are the common things you see in your practice? I mean, as an internal medicine doctor, and the Americans call it an internist, right?
Yes.
Right.
Yes.
We're talking about the same thing.
Yes. Same thing.
Yeah. So, what are the common problems you see?
Okay, so in our population, we do have a large number of persons who have hypertension and diabetes. So I think these two are probably the top two that I see.
Yeah.
So apart from those, patients can also have high cholesterol as well. Other common things, you see patients who have thyroid disease.
Thyroid.
Yes.
Yeah.
Which I'm sure that you see as well, you treat.
Yeah, and that's why I was so happy, because before the program started, we were talking just about getting to understand her areas of interest, and she said endocrinology is one of them. And I know for a fact that when I see many of the thyroid patients, and we do need the services of an endocrinologist, I hope when the spirit moves you that that you pursue that to a much more detailed area, because I always believe that part of our role is to elevate the quality of care and the expertise in our country.
I agree.
And I think that the more specialization you can bring, the more better it is for us.
The more we have to offer St. Lucians. Yeah, agreed.
Yeah, so the internal medicine, the endocrinology is quite a broad area. Can you just say a little more to the general public as what is an endocrinologist?
No problem. So the endocrinology looks at, I guess, the endocrine system. It looks at different hormones in the body that regulate many different processes. So we mentioned the thyroid, which is one of the glands that produces thyroid hormone, which is responsible for many of the processes in terms of, metabolism and energy, controlling your heart rate and things like that. You also have the adrenal glands, which producing many hormones like cortisol, aldosterone as well, which is responsible for controlling hypertension and salt in the body. Right now, one of the big topics is obesity, which falls under endocrinology. Given the rise in obesity, we see a lot of complications in obese patients. Another thing we study we look at is the pituitary gland, which produces a list of hormones that regulate many other processes in the body as well.
The pituitary gland?
Yes.
Where is that pituitary gland situated?
In the brain.
In the brain?
Right in the center.
In the floor of the brain.
Yes.
Yeah, in the brain. So
the base.
They call the pituitary the master gland.
Yeah.
Because above the pituitary is the hypothalamus part of the brain that secretes the releasing factors. These releasing factors find themselves in the pituitary, and from there, the pituitary produces the releasing hormones. Yes, the stimulating hormones, and there are many of them.
And they stimulate many organs.
Yeah,
the
all the
thyroid, the adrenal gland, as I mentioned earlier, the ovaries.
Even very recently, I had a patient. She told me, "Doc, apart from the headache I have a little. Sometimes I don't think I see properly, and I just find my breast sending milk. You may not connect these, but it's the pituitary gland that has a stimulating hormone called prolactin stimulating hormone. That's the name of it, of course.
Prolactin, yes.
Right,
yeah.
Prolactin, and prolactin is goes into the breast and stimulate the breast tissue to produce milk. That happens so fast you would not believe it.
But she's pregnant?
No. No, she's not pregnant. The issue there is that she has in the pituitary there can be tumors or adenomas, which is non-cancerous tumors that produce the prolactin, and it goes into the breast. True, I'm correct, of course.
That's correct.
So that is how it happened. Now this system is along all the animal kingdom, right? Not only human being, because I know a farmer who raised pigs, and don't discount pigs. Pigs are very close to us. Because look now, I had our kidney. We borrow a kidney from pig, and now taking pig heart for transplant has been a regular thing. But anyway, I'm not on that chapter. The chapter I'm on is that the pig had a lot of little babies, and the milk will not come. So he asked the agricultural guy to come in, the animal expert, and the guy took a needle with a little bit of oxytocin. Sorry, of that's what prolactin. Inject, and in minutes, milk started flowing all over the place.
Wow,
interesting.
So so all these things happen. So basically, I'm talking about the diversity of endocrinology, because the endocrine glands an endocrine gland is basically a gland that secretes a chemical, and the chemical is a hormone. It goes into the blood and have a remote effect elsewhere in the body. So that is what the endocrine. So I am fascinated by that gland because you can see the effect of it in many areas.
Agreed.
Yeah. So what else? What other areas? You tell me that you enjoy pulmonary things. So what about it that you like?
What do I like about pulmonology? So I guess during my training residency program, I did get to see a lot of patients who have things like interstitial lung disease, where you have damage to specifically to the lung tissue, and that could be caused by many different things. Exposure to certain irritants that you inhale, infections, or even having chronic conditions or inflammation in the body.
How much lung stuff you see in St. Lucia?
So the more common thing that we see is COPD. Given the prevalence of smoking, especially in the young population, persons who are less than 40. And occasionally we will see some things like bronchiectasis, where you have damage to the lung tissue. It's a bit enlarged, and that prevents or causes difficulty breathing and cough.
Okay.
Yeah.
So the COPD is not the same as asthma?
No, it is not the same as asthma. You could have similar complaints, because patients do complain of chest tightness, feeling short of breath, and they could both wheeze. And when they present it to the ER, the treatment is similar, but the conditions are not the same. The difference being, usually if you have asthma, you would have the history from childhood. You may have a history of, allergies as well.
Okay.
But with COPD, usually it presents when you're older, and it is very highly associated with smoking as well.
Okay, so most times, the way I understand it, that COPD is something that you put onto yourself. You do to
Instead
yourself.
of looking at it, yes.
And asthma is something that happens to you
Yeah,
because of
inherited.
your inherent
Yeah,
allergic predisposition.
right.
Mm.
Yeah.
And
Let me just ask a quick question. As far as the COPD is concerned, can you take us, because we hear about it, but we don't quite, I don't quite understand it. And I've seen patients who are suffering with it. So can you tell us what happens? Why does what does cigarettes have to do with it? And why is it so debilitating?
Okay, no problem. So when you smoke, you're inhaling first the smoke, which is an irritant to the lining of the airways where you breathe in. So because of that, over time and doing it repeatedly, that can cause damage to the lining. It will destroy the cells in there that are supposed to prevent things from going in.
And by the way, is that any type of smoke we're talking about?
So yeah, that could actually happen with exposure to smoke. So if somebody makes coals as well, they could develop COPD. Yeah.
Because some people believe if you smoke marijuana, for example, it does not have any negative side effects.
So that can happen.
So
with
is
inhalation of any
marijuana
type of
included
smoke.
there as well?
Yes.
Yeah?
Marijuana
smoke?
as well as nicotine. But patients who smoke marijuana, most of those that we see with COPD is because they mix the COPD with the nicotine or the tobacco.
You mean they mix the marijuana?
Yes,
Yeah.
thanks for correcting me. Yes, so marijuana smokers, if they do develop COPD, it tends to happen a lot later, many years after smoking, maybe 50 or 60 years later, as opposed to a marijuana smoker who smokes tobacco. They will present with COPD maybe after 10 years, 15 years of smoking.
Can you explain why do they feel they need to smoke both? I don't understand that.
I don't know if I'm equipped to answer
maybe they're
that
high.
question.
You should ask them.
Well, I don't know who they are. That's the thing.
Yeah,
'Cause,
that's right.
I'm not sure when you see them smoking. I'm not sure exactly what is that they're smoking. So yeah, why? I don't understand. If you already smoking the marijuana, what's the need to mix it?
Let me see.
I mean, you see patients, right? Certainly.
Yeah, I think I've heard, because I think somebody did ask that question, and I think a gentleman said that when you smoke marijuana by itself, it causes more cough, but when you mix it with the tobacco,
There's less cough.
yes. I don't know if that's the only reason or that is the reason. But
So why is it now that they don't just don't stop it if it's creating a cough? Okay.
The smoke, the cigarette,
Yeah.
the marijuana smoking.
Well, whichever, that's creating a cough, because a cough is not a comfortable thing. So why would they want to mix it?
I guess they want the effects of the marijuana, which is with the short period of cough.
Oh, okay,
Yeah.
all right. I think I understand what you're saying.
Yeah.
And maybe you can explain that as well. And the nicotine is addictive, and an addiction is something that when you stop it, it begins to cause symptoms in you that you want, you crave for it.
I see.
So it could be that starting with the cigarette causes you is causing you to feel the addiction, and that's why you go at it all the time. But what is sad, I find, is I can understand, maybe I wouldn't even say that, but I can understand if you drink alcohol, you get a high, and then it goes away, and so you're back to normal. But for cigarette, I cannot see what is in it in the beginning that gives you such a high that you cannot do without it.
So the cigarettes actually give a high, regular cigarettes, yeah?
Yes.
They give a high.
Well, I think
It does.
the nicotine, and apart from it giving you, it makes you feel a
Stimulated.
stimulus. Yeah. And so that's why. But I think when you stop it, you get the reaction. You get the need to have it.
More.
But and maybe from what I understood, marijuana doesn't do that. So when you stop it, you stop it. I don't think you get hooked onto it as much as cigarettes.
Not. It is somewhat. It is addictive,
Is
but
it
it's not
addictive?
like nicotine.
Oh.
So,
Yeah.
so Dr. Augustine, if I understand you correctly, you're saying in the case of nicotine, you most likely will develop COPD. Most likely, right?
Yes.
More than likely. But if you're smoking marijuana, you most likely will develop COPD, but over a longer period of time.
Marijuana alone.
Yes, yes.
Right.
Marijuana only.
If you smoke marijuana alone, you may get it, but at a longer.
Yeah,
but
much later in life.
Mhm.
But if you mix the two together, you will get COPD even earlier.
So it just goes to show then, how really dangerous nicotine really is.
Yeah.
Yeah, the
I think
combination of the
the
two.
late Dr. Didier did a lot of work on, and I think he did many sessions on public lectures on COPD and that kind of thing. So I'm just plugging in that just.
So, excuse me again. Just understand, so with the marijuana, when you use the marijuana, you say, is that correct? It causes you to cough?
That's what I've been told. Yes.
And
It
to
makes it
alleviate the
irritates,
coughing,
Yeah.
to alleviate the coughing, they mix it with the nicotine.
Yes.
To
I don't know if this is,
with
a
the
hard and
tobacco.
fact rule,
Mm.
but
Your tobacco.
yeah.
Yeah.
But that's what I heard somebody say. Yeah.
Maybe somebody can clarify that for me.
Maybe somebody can call
Yeah.
in.
So you, so if anybody wants to call us here, you can call at 572-9710 or WhatsApp at 287-0971. Just in case you have a contribution to make at this point.
Yeah, let me just repeat the numbers. The fixed line is 572-9710, 572-9710, or you can WhatsApp 287-0971. WhatsApp is 287-0971. So again, sorry, Dr. Surage.
No, go ahead.
So take us into this COPD thing. What is this person's world like when they diagnosed with COPD? And by the way, I guess you do that. You diagnose them and say, okay, this is what you have. So what are the symptoms and what is this person going through?
Okay, no problem. So
Before you answer, I call him John Public.
That's right.
He represents the public. So go ahead.
no problem. So so if you have a history of smoking, a long-standing history of smoking, so one of the first symptoms that you may notice that you get tired easily. So usually, if, for example, if you work in construction, you could go through your day, no issues, no complaints, but then you notice that when you are carrying a bag of cement or 2 bags of cement, you feel like you need to stop. You're a lot more tired. You feel a little more short of breath as well. So that is usually the first complaint that patients have. Some people complain of cough. They cough a little more throughout the day, especially in the morning when they wake up, and sometimes they're even bringing up a lot of mucus. Depending on how long they've had the symptoms, they could even have some weight loss. They don't usually get any chest pain, but the main thing is the shortness of breath and feeling more tired. It's very noticeable because the lungs are responsible for bringing in oxygen and having that oxygen go into the bloodstream. But if the lung is damaged, then less oxygen is brought into the body. So that is noticeable with their physical activity.
You have a call, Dr. Surage? You can use your headphones. This is Doctor in the House with Dr. Leonard Surage.
Hello.
Good evening to all.
Good evening,
Good
sir.
evening to Radio Land.
Good evening.
Thank
Good
you.
evening, Andre. Good
Yeah.
evening to both of the doctors, Dr. Suraj and the young doctor. Good evening. Welcome again.
Good evening, sir.
Yes. Can I add my 2 cents?
Yes.
And certain things that I get to know about COPD as much as I don't have. another patient. I will actually see some of what I need to talk about in Creole and English, as I always give you my patois version.
Absolutely.
St. Lucia, it is a very ticklish subject, and some people may not have the time right now to speak about it. And I know a lot of them, Dr. Surage and your doctor here, knows that St. Lucia have a big, Dr. Augustine, thank you, appreciate that. Dr. Augustine, that a lot of St. Lucians is exposed, and a lot of, especially the young folks, they will inherit. When I say inherit, it don't impose on you, you impose it on yourself. Let's get that correct. Okay, you have a touchlight looking for it out there. That's my version of saying it. Okay. It don't impose like family background and nothing like that. And I'm going into this is because I have some siblings of mine. When I say have some siblings of mine, not one, not two, three. My dad died of COPD, God rest his soul. And my mother used to smoke a long time, cigarettes. I remember going and light the 3-5 for her and everything like that. But she quit it a long time. So she was disciplined enough to get rid of her habits without going to rehab, and that's a good thing, eh? You must say that's a good thing. Anytime you can do that without going to rehab, exactly. So I know about it. I have a lot of time for people that never been to rehab, and they do away with their habits. So props to them. Let's go a little further. As I said earlier, it's not being imposed on you. You're looking for it. So I think the government of the day have a lot of investment to do when it comes to COPD patients, because it's just getting worse. Because everybody believes they have a right. I'm a big man, I'm a big woman, I have a right to smoke whatever I want. Because as Andre told you earlier on, if you ask the reason why they're smoking, it's not any really good reasons, but it's sometimes is they see their friends doing it because of weakness, because I would say peer pressure sometimes. But again, the last say is you, okay? Because we have choice. It's not a circumstance, it's a choice that you have. Okay? So my siblings, I don't know if it's from, it happened to me where my parents, especially my mom, used to send me a light. And it happened to most of us at the time, where they send us and light the 3-5, the diamond, and then you bring it for them and everything. I never it never stayed with me as a habit. Okay? It's just that some of us, are weaker than each other or stronger than each other. So on that part, I would say that it never stays with me. But I know it used to happen where they used to send us and light the cigarettes. Okay, so that's a start there. It wasn't a good thing, but that was a start. Send you and buy tobacco at that time. You children, they send you and buy tobacco. Even the alcohol at the time, certain places I think it was illegal, where they would, put it in a nylon or bag and then send you and buy it, because as young children, you're not supposed to sell alcohol to you. It happened to me, I could tell you all of that. Okay, my mother wasn't a drinker, but she used to actually smoke. But my father was both. And sometimes when you think it's something else that you have, is when you go to the test and they will tell you, listen, he doesn't have enough oxygen in his blood or whatever. And this is what I get to know about my dad. And my dad thought it was something else that he had. And when I came through and I remember what happened that day. They gave me the blood sample on ice in a bag. Can you imagine, in a bag, and I had to take it to Tapio. I remember that. Yeah, to take it across. Yeah, and then I waited for the test and everything. I went and get the cash to pay it and everything, and then they told me exactly what happened. Imagine when I told my dad what happened, because he thought it was that he had, and it wasn't that at all. And imagine, as bad as it is, my father thought that's what he had, and that wasn't the case. So you see, when you don't know your health status, or your status, it's the worst thing that you just saying anything that you want. And is when I get to know exactly what is wrong. And could you imagine somebody's making medicine, local medicine, or what you call natural herbs or whatever, trying to do away with what he says that he have. That doesn't mean that's what he has. And I could tell you that as a child, when I came forward and I took, when bring the tests and everything, that's when I get to know what is wrong. And actually what I told him, it's just that to him, probably he felt a bit happier that probably he knows that's not what he thought that he had that killed him, you know. And let me tell you something, that was a big relief to me. I don't know for him, but it was a big relief to me. You understand? Because I think it was so sensitive. I think it bring a little separation between him and my mom, you know, because my mom didn't want to stay exposed to what he said that he has. You understand? And you see, sometimes that is what that had them to live apart, you know, because they both were married, you know. So I could tell you that story when it comes to COPD. And I have like 2-3 more siblings with COPD. Okay, one that just died last year, you know, and same COPD again. And after that, my nephew. So I know what it is. My first cousin died of COPD, and yours truly could tell you, I brought him down Canaries to have fundraising dance to make sure I raise, you know, enough funds for him and everything, get him the nebulizer from the government, or, you know. So I tried my best. I know what it is. So if this is something that I could tell somebody, anybody out there, please, you see these things about big nations, we see nations doing it, big countries doing it, and we think that it's not for good health purpose, but yet still we go in there, we're not disciplined enough, and I use the word discipline, we're not disciplined enough to stay away from the things that could actually hurt us. We know that there's signs telling you you're not supposed to. There's things telling you to be cautious. The cigarettes tells you what is it that you will indulge in. What you indulge in, it's not good. It's bad for your health. Yet still. So I think, I don't know if it's ignorance, but it's something sometimes we need to prove to each other that I can do that, I'm a big man. Because if you ask, as I told you earlier, if you ask people, why are you smoking? Why are you drinking? It's just that, well, that's all. Drink it, you die, don't drink it. Smoke, you dead, don't smoke. That's what they will tell you. You understand? So that is why I find that song, it hurts a lot of people that don't read often, because as I would say to anybody, it doesn't matter what people say to you, you need to know it to yourself. So this is why I find out what was wrong with my dad, and I told him, and I got relief from that. And it doesn't stop there. Yet still my brothers went ahead, COPD. My sister, COPD. So that's how bad it is. And there's 2 brothers of mine. I suspect there's a 3rd one. You understand?
Can I ask
and
you
let me
a
tell
question?
you something.
Sorry to cut you.
Sure.
Since you had a lot of experience with people who have COPD, can you tell us some of the symptoms, or what did they suffer with their COPD?
Great. Yes, and I was told even by some of the practitioners that will, work on them and let me know, okay, they might be suicide. Is he suicidal? You know, like they get angry very fast, like they get hyper, and most times they will have loose bowels because their organs are failing from one to another. You know, so it's like, and certain things they're supposed to stay away from, sometimes they want it. As you said earlier on, Dr. Surage, the cravings, the things that's in there. I see people when I used to live in Conway, you know, people leaving their homes 3-4 o'clock in the morning with just an underwear or just a towel around their waist, looking for it. They need it, they want it. So sometimes it's just not the habits, but the cravings are so bad, Doc, so bad. That alone could just throw you down the cliff, you know. And I saw it with my siblings when it's like when you think he's probably passing air, he would just like puke on him.
Okay.
And let me tell you something. It's so bad. But the worst thing is, let me share something with you quickly. What happened? What you find is he used to actually smoke with the substance, and he used to mix the marijuana with something else. And guess what? At the end of the day, I saw it in his bag. I saw him smoking it, and somebody told me, if you come, let me show you, your brother is smoking somewhere. And I know he's doing it, but I don't want to put pressure on him that even as I told you, the habit is bad, far as the cravings. Because some people could do things and they could adjust to say, okay, I had enough for now. But he just actually wanted it. And he always have it. And guess what? I remember, even if he was the closest to me, I was the closest to him because I was caretaking him, you know? I was taking care of him. Guess what? When he passed away, I spoke to him, the last person. I tell him, okay, la, we okay, la. Well, just catch you check up hello. Imagine I call him, he called me back in the morning, the doctor. From the time the doctor called me and he told me, listen, I had a nurse saying, Doc, tell him or you will tell him. I knew it was something that he's gone, you know? And guess what? I get the substance when I went through his bag and everything, it was there. He never get rid of it. As I told you, I knew I had a good pressure. So he died and he still had that substance on him. So that's to show you how bad it is, Doc. So I could give a revelation when it comes to this. And I could never see myself going down that road because I saw it. Okay? And this is why I'm learning. My life is always under construction every day with my parents, my siblings. Whatever bad I see they were doing and they didn't know better, I learn from that. I take a page from that and better it. This is what I could tell anybody who smokes. This is not the best thing to do because sometimes you could never stop when you got started. Okay? So that's one of the worst things you could do. And Doc, this is so important to let St. Lucians know. Please, plead to them. I'm pleading to you, please, people, whatever you're doing, smoking is one of the bad things because sometimes they're doing both. And that's the worst thing. They're hurting themselves and their families that love them have to stay back and care about them and sometimes they have to quit their job to go and take care of them. And that is the bad thing because you see the saying about do it, you go there, don't do it. That is just a say. But at the end of it, somebody has to care to leave, to quit their job to go and care for you. Okay? And this is the bad thing about it. Okay, Doc? And I hope people are listening closely and take heed. Please, young men, please. When you go to a boat ride, any session you go to, the fellas that are smoking and the ladies are there having a good time, they're hurting themselves. They don't last because again, I mean, with sex it's an art. You need to be brave in it, and so all these things gonna hurt their relationship. Doc, they don't know that. So please, plead to them the way I'm doing right now, please. Okay?
Great.
It is a fact. We need to stay away from this. Okay, St. Lucia?
Thank you.
All righty.
Thank you very much. And I appreciate. I mean,
Bye-bye.
he would say it in a way that I can never convince the public as much as he can because he's coming from experience.
Yes, and a lot of experience.
A lot of experience, and I'm happy that he had the bravery to come and share that kind of information with us, and I appreciate that very much.
Okay, we'll just take a little break now. I'm Dr. Surage and get back in just a moment. This is Doctor in the House Live with Dr. Leonard Surage with the compliments of La Place Salazon and Tapia Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapia Hospital, where the patient's safety comes first.
It's delicious.
La Place Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazon, of course. La Place Salazon, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
Okay, welcome back to Doctor in the House live on Rev-Up St. Lucia with Dr. Leonard Surage. Dr. Surage, before you continue, I don't know if you picked up something the caller said. He was speaking about, I think, either his father or I wasn't sure exactly.
His father.
Right, and he said that apparently the father had kind of sort of self-diagnosed and trying to figure out what his issue was. And he went to some natural healer saying that this is what he has. And the caller was saying he didn't have that. That's not what his problem was.
Yeah. So when they did the test.
Yes, so I know you've spoken about this already in terms of the natural healing, the natural healers. And I mean, here they are, I guess, kind of guessing as well what your problem may be. And that could create more problems because imagine you're treating somebody for something and it's not what you think it is.
That's right. Because the development of medicine or the history of medicine is such that medicine went through the natural process and after decades or centuries of practicing the the natural method, they try to make it a little more scientific and a little more reproducible and a little more predictable and a little more safe. And that is how we end up with current medicines, whereby you know the side effect of all the medication, and you have strong organizations that ensure that the medicine must be of a certain quality. And you know the side effects, and you know what will happen long term, and you know an overdose, when you take too much, how do you combat it? So all these are the evolution of the medical services. So although we look at a natural medicine and think it was just discovered, but current medicine is an improvement over natural medicine. So
it's also important to note, Dr. Surage, that if we develop certain symptoms, we need to go see a doctor.
Yeah. Because, okay, if you have a cough, and you yourself know about 3 causes of a cough: asthma, COPD, or a cold. You only have 3 from which you can pick which might be the right one. But if you are specialized in that area, like pulmonology, if you specialize, when the person say cough, you already look at their age, you look at their height, and you look at whether they are male or female. And so you're beginning to, of the thousands of causes you begin to weed it out. And then you ask them questions. How long are you getting fever? Do you bring up anything? And the questioning itself will rule out another 50%, maybe 80%. And then you examine the person, listen to the chest. And then you can, by examination, you can rule out another 90%. So you are at the end of the examination and all that. You may have the diagnosis part on or correct, or you may require a test or 2 to find out. And so this is the process that is taken when a patient come and sit in front of you and say they have a cough. So if you did not know any of these things, you would have just said, maybe it's a cold, maybe it's asthma. Oh, you have asthma, man. Take 2 bush tea or whatever for your asthma.
Yes.
And so therefore you might be on the wrong track and continue on the wrong track.
That's exactly what he was saying.
Yeah. And so when they did the test, they discovered the difference.
Exactly. So anyway, you have another call.
Oh.
Yes. Good evening. This is Doctor in the House with Dr. Leonard Surage.
Good evening, Andre. Good evening, Doc. And
good evening, sir.
Good evening.
Talk to me.
This is Dr. Alpha Augustine.
Oh, yeah.
Okay.
Sorry.
Okay. Thanks for accepting my call, eh?
You're welcome, sir.
No problem.
Okay. Doc, is smoking the only thing that can give one COPD?
No, it's not the only thing that can give you COPD. You could, if you make colds, for example, and you're exposed to the smoke from making colds, you could develop COPD.
Oh.
You could also have a genetic illness that can cause COPD as well.
What about the secondhand smoke?
Secondhand smoke, yes, is a
I
cause.
was coming to that. You cannot get COPD from asthma. If you're asthmatic, you cannot get COPD?
You can develop COPD if you're asthmatic and you smoke.
Oh.
Yes, you can. You could have both asthma and COPD as well.
What?
Interesting.
Yes, you can.
And can one get COPD between the age of 10 to 15?
So to develop COPD at that age, you would most likely have a genetic disease to develop COPD. But usually 10 to 15, you're not smoking, hopefully, or you're not exposed to large amounts of smoke, and that's for a short period of time. So you would unlikely develop COPD from exposure to smoke.
And Doctor, final question. From the COPD patients you have seen, what's the lowest averaging age you have seen?
Late 20s. So maybe 28, 29, just about 30 years old.
Wait. So anything before that, like your organs are strong, it might be a little difficult to to get those things. How far you saying?
So if you've been smoking from a teenager, you are exposing your lungs to being damaged. So it will take a few years before the lungs become very damaged to be short of breath or have the cough and develop COPD. Sometimes you could have COPD and not have any signs or symptoms of it. But if you do continue to smoke, eventually the damage gets worse and you will become sick.
Okay, Doc. Thank you.
You're
Okay.
welcome.
Thank you.
Thank you very much. Now, since COPD seems to be so
That's okay.
topical,
Yes.
what exactly is COPD? I know, if I'm correct, that it is chronic obstructive pulmonary disease, not that?
That is
So what
correct.
that really is in terms of what's happening to the lungs that makes it COPD?
Okay. So due to the continuous damage to the, I want to say the airways or the pipes that carry the air to the lungs from the smoke or for whatever cause, they become a bit thick. They are not as pliable and flexible as they usually are when we breathe in and out. So because they become fixed and they're not as flexible, when you breathe in or breathe out, they don't regulate the air very well.
Okay.
It doesn't change the temperature of the air very well as it is supposed to, so you become short of breath. You cough a little more because your body is not able to clear the secretions, or you have more secretions being produced in the lungs. So it is called chronic because it is there over a very long period of time. And because the tubes or the pipes are not as flexible as before, they obstruct or prevent the flow of air in and out of the lungs.
And
Excellent.
Yes, explanation. So the patient now, for the most part, has to be in a hospital or at their home?
So the patients we see in the hospital are those who are very ill, generally very short of breath or have had COPD for a long time. If somebody who has COPD and develops a lung infection, that can cause like a crisis of the COPD, and they will present to the hospital, especially if their oxygen levels are very low. But COPD persons can be managed with the medication and live a normal life, depending on how bad it is or how severe it is, and if they stop smoking. Another thing to just point out that COPD is not a condition that is reversible or it cannot be cured.
Wow. So there's no medication you can take that would cure the problem?
No. So the medication is just used to manage the problem in the lungs. And one of the important things is to stop smoking. If you continue to smoke, the disease will get worse.
So are you saying to us that there are people with COPD who still smoke?
Yes.
Wow. Wow.
Yes.
You have another call, by the way.
Hello.
Yes, hello, good night.
Hi, good night. Good evening.
Yes, good evening to the doctor and Andre and everybody here.
Good evening, sir.
Good evening.
Yes, I'm listening to the program then and find it very interesting because I know a lot of people that have contracted COPD, and I still know young people that have died. And currently there are those that are smoking the marijuana mixed with cigarettes. Some mix the hash. I know you'll mention about the hash and the cigarettes because they say I don't know if they don't like the marijuana much, but they're mixing the hash and the cigarettes. I know that you all talk about the nicotine in the cigarettes, but I know they have other people that have contracted COPD and they said, the doctors said that they have mole on their chest, on their lungs.
Yeah. Mole is a kind of fungus, yeah.
Yeah, because some of them they told me they used to work with furniture that had mole and they got the mole end up infecting their lungs and they used to bring up some kind of green mucus. Plus they were smoking too.
Is that a
I
myth?
don't know if
Sorry, caller. Is that a myth, Doctor?
No, it's not a myth.
Augustine?
No, I would say no. So if you have COPD, that increases your chance of infection, and that could be viruses, like Doc said, mold, bacteria, any infection to the lung.
Yeah. But I was just calling too because I seen like the younger generation, they don't seem to be wanting to listen to anybody that comes to them and explain to them about smoking. Because I remember Dale Elliott did a documentary on the COPD. And he went to all different places around St. Lucia to different people he interviewed that had it, and then later on they end up dying while doing the documentary.
Wow.
Yes, because it seems like the younger generation, they don't care. Because I myself, I used to smoke, but I raised up in the 80s. Now I stopped smoking because I realized a lot of people around me are just falling down, dying like flies. Now, people used to mix the tobacco, the black tobacco with the molasses in the marijuana. But all of a sudden now, the younger generation, now they're mixing the cigarette plain. Now, when you look at a cigarette itself, at the end of the cigarette, it has a kind of filter.
Yeah, that's right.
Now, when they break the filter, they break the filter and they take the contents of the cigarette and then they mix it. Now, I don't know if the filter is there to break down certain chemicals within the cigarette. I'm not sure.
That's a good question. That's a good question. You have an answer for that, Dr. Gaston?
The filter is there to prevent certain substances in the smoke from getting into the lungs. So,
That's right.
Oh.
yeah. So there are still toxic chemicals that
Nonetheless.
you inhale with the filter, but
Yeah,
it just reduces the amount.
Now it reduces the amount, but when they take out that filter and they mix the contents of the cigarette directly in the weed and they smoke the weed. Now when they smoke the joint, they don't have no filter of the joint.
You're even more exposed.
Yeah, that's true.
So that goes directly into the lungs, and that's why I'm seeing and noticing younger people are developing this COPD more, and it will be worse in time to come. Because watch social media, watch all these music videos that promoting smoking. So we have an epidemic right now in our midst.
Yeah.
Now that's why I say what you all are doing there is very good and informative, but how many people are listening? How many young people are listening to what is going on there? Because in time to come, a lot of families will be crying. Look, a caller called earlier and he said his father, his siblings, his brother, his sister, everybody. He just seen them falling, suffering, and what they can do. Even though he said one died. When they check the contents of his bag or his body, what on him, they got the substances on him. That means while he's suffering, he's smoking.
Right. It means that the addiction is so strong.
You see?
Yeah.
So to me, there is something else that maybe we should not to create for people to just come and buy. They don't care about humans. They just care about profit.
Well, the doctor was saying earlier that nicotine is addictive.
Yeah.
So that is the problem right there.
Highly addictive.
Yeah. You actually crave it.
Yeah, because I remember a few years back, people used to, they tried to take the cigarette companies to court and try to prevent them from selling cigarettes. But the companies now, they add on the boxes, it is dangerous for your health. They put how much different sicknesses, the gruesome view of what it can do to you. But people already study that. They don't care that because the craving is so high. They don't care about the consequence.
Well, I must compliment you, caller, for having being a smoker yourself and come off it. That level of discipline is tremendous, and I wish more people will do that.
Yeah, I seen a lot of people dying around me, so it gives me the strength to check on my health instead of a cigarette. When I look at a cigarette, I think that's a couple of coffin nails that's in a box.
But the other thing I wish to say there is, if you catch the people early when they are making that decision, is perhaps the best time to prevent them from doing it. But once they are hard onto it, it's a little more difficult to stop them. And I think also the company you keep is very important, how your life will run.
Now, that's why I said a while ago, social media is still a company. So just imagine a child, a teenager has their phone and they're noticing all their idols and people they look up to smoking and feel like it's good. Even though their parents try to beg them, cry, stop that, it's not good for you, you get sick. But their idol, the social media partners, they're doing it. Now, I know two young men, young guys, I know they start smoking from maybe in their 14, 12, 14, and they smoke the tobacco and the hash and the cigarette from that age. So I heard the doctor say, somebody asked, what age can somebody contract the COPD? So I don't know if from that age, maybe 12, coming up to the 20s, if that will have a drastic effect, or if they will get the COPD earlier. I just want to find out. So.
Well, allow the good doctor to answer you. Okay, my friend?
Yes.
Thank you very much for that call. Thank you.
Thanks.
All right.
Thanks.
Yes. Dr. Augustine?
So usually if you smoke, you will develop COPD after about 10 to 15 years of smoking, depending on what you smoke. Okay? So since this has been the topic of tonight, I just want to appeal to the smokers. If you do want to stop smoking, there are support services and there are treatments available to assist you in quitting smoking. We know it is challenging, but there is support and there is treatment to help. So you can see your doctor about that.
He mentioned hash as well, and its role in this whole affair. Tell us a little more about that.
Hash.
Yes,
You know about hash?
yeah.
From the little knowledge, I think hash is mostly marijuana that is burnt and the oils and stuff from it. So I don't think that hash has tobacco. You could correct me if I'm wrong.
I am less knowledgeable.
Yes, I think you'll have to do a little homework,
sure.
Dr. Surage, on that one.
On that hash.
Yeah.
The connection of hash.
But
I wish I don't know if anybody in the audience listening knows about hash. Maybe they can tell us.
In the do a little homework, Dr. Surage.
Huh?
Do a little homework. Just before we leave, this is important. He said something that is really, really important. Well, relevant. As to the program, this program, the whole idea is to disseminate information to the public.
Right. Yeah.
And he said that young people most likely will not hear this message because it's true. They're usually on their phones and so on. Radio is not the thing. I mean, I speak to young people all the time, and they don't even know about FM, and you know, all they know is that the thing is online, and that's where they go get information. Now, he also said that you have a pack of cigarettes, and it says to you, cigarette smoking is dangerous. We don't even read. We don't even read, as a matter of fact, to even take note of that. So, Dr. Surage, how do you reach these young people, the ones who are doing the smoking and who will become a problem down the road for Dr. Augustine and the whole healthcare system and so on? How do we reach them, because they're not listening? So and then even if it's their parents listening, right? How can that even make a difference?
Okay, I'll tell you. We are doing what we can out of our own volition. We are not operating on a strategic decision making that we're going to tackle this as a healthcare option. So I think the planners have to plan what the priorities of health is and begin to direct resources. They can have a very broad-based approach to what we consider the priorities, what we really want to address, what issues or what medical conditions we want to address, and begin to develop private and public sector participation and begin to put resources in it to make it happen. We are volunteer people. We, out of the volition of our heart, we are doing it, and we are asking other people to join us. But that can only reach a certain level. It can only reach a certain group of people. And if the authorities really want to make a dent or to make a significant contribution in health, that is where they must do. Begin to look at priority areas, put resources in it, ask participation, and let it move.
So just a quick question before we end, Dr. Augustine. You mentioned earlier that we have a lot of problems with diabetes, hypertension, and those areas. Well, as you mentioned, COPD was the hot button issue for tonight.
Yeah,
now, most people will probably go to a general practitioner to deal with those issues, generally, right? So in terms of your role as an internist, what more can you offer a patient? Why should a patient come to you at Tapio?
Okay, no problem. So most of the patients that I see with hypertension and diabetes are the ones that are a bit difficult to treat. So they are on the general regimen of medications that are available, and even with those, their conditions are very hard to treat. So I can do further evaluation to see if there is any specific cause that is causing their hypertension to be.
So are you saying, I'm sorry to disturb you, that the doctor or the general practitioner, because of the severity of their problem, would recommend that they go see you?
Yes.
Yes?
Yes.
So, are we winding up now?
Yes, we are. Already past 7.
Oh, sorry. Well, I wish to tell the general public that we quite appreciated the calls, and I think the calls were substantial calls and very, very informative calls. Far more
good
informative.
Questions. Good questions.
Yeah, good question and good contribution from practical experience. And I'm very happy that Dr. Augustine was there with me. And by the way, Dr. Augustine actually replaces the late Dr. Didier. That's where she was.
Oh, really?
Oh. She's the replacement.
You're stepping in some big shoes.
Some big shoes, huh?
Big
Yeah.
seat to fill.
Wow.
Yeah. And so I'm happy to have had her today, because as you can see, I would never be able to deal with this topic without her. So, Dr. Augustine, thank you very much.
Thanks for having me. I enjoyed the hour with you,
All right.
gentlemen, and the public.
Okay, thank you. And next time, same place, we'll see you again, and all the best.
Thank you, Dr. Surage, and thank you, Dr. Augustine. This has been Doctor in the House, exclusively on Rev-Up St. Lucia 97.1 FM, every Tuesday from 6 p.m. to 7 p.m. And Doctor in the House is brought to you with the compliments of La Place Salazar and Tapio Hospital.
Tapio Hospital's pharmacy is always well stocked to meet all your prescription and healthcare needs. We also offer specialty drugs for cancer patients and for various other medical conditions. Call our pharmacy at 459-240.